Thank you for joining us for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We're hosting a press briefing today to provide an update on where we're sitting with COVID in Itasca comparatively to this time last year, and to recognize and honor some of our organizations and people who have stayed strong with COVID prevention and have remained kind and supportive of our community during this very long-lasting global pandemic. We'll hear from Sue Esty, Executive Director of Second Harvest North Central Food Bank, Andy Morgan, Captain of the Grand Rapids Police Department, Logan Cushel, Engagement Team Lead, and Abby Lane, Store Director from Target in Grand Rapids. And for question and answers, we will have John Pedersen, Interim Vice President of Operations from Grand Itasca Clinic and Hospital. In Itasca, we have seen more positive cases this fall than we saw at the same time last year. Last year, our 14-day case rates were between the 30s and the 50s as we moved into hunting season. And this year, we've already been in the high 90s, and we're sitting at 84 today. We saw some preliminary plateauing of positive cases last week. However, this week, we are seeing increases in daily positives again. COVID is certainly not through with us. And we do encourage our community members to dig deep and stay strong with your mitigation measures. Not only do we strongly recommend getting vaccinated from COVID, but also to wear your mask, stay 6 feet from others, and keep your gatherings smaller. These measures all work to keep our numbers down. We want everyone at hunting camp to bring back stories and not illness. We have some exciting news for vaccines. Our 5 to 11-year-old youth are eligible to receive the Pfizer series. It is a lower dose than our teens and adults receive. Our local clinics are all set to begin administering next week. And for our teens, the state of Minnesota has an initiative for our 12 to 17-year-olds called Kids Deserve a Shot. They can receive a $200 incentive for completing their series right now. And then there are also scholarships and other opportunities offered for those who have been vaccinated even prior to now. And some of these other opportunities are in partnership with the Minnesota Vikings, the Minnesota Twins, First Avenue, and some other groups. And you can find out more about this at mn.gov/COVID19/vaccine/vaccine rewards. And there should be a link on the Kids Deserve a Shot on any of those pages. And we understand incentives are certainly a controversial topic, and they're a hot topic. And for those of you concerned, parents, do rest assured you have to offer permission for your child to be vaccinated if they are under 18. And incentives are a way of offering a carrot versus a stick. And they do work well for someone who maybe just hasn't taken the first steps in receiving the vaccine, although they have full intention to pursue a vaccine. In other vaccine news, boosters are available. Anyone who received the Johnson & Johnson vaccine prior to 2 months ago and are 18 and over are eligible to receive a booster. For anyone who received the Pfizer and Moderna vaccine series 6 months ago or prior, if you are in the following groups, ages 65 and older, if you're 18 and live in a long-term care setting, if you're over 18 and you have some underlying health conditions, or if you work or live in some high-risk settings where you have a lot of contact with the community, you are eligible to receive a booster. And you can access this from a pharmacy, from any of your clinics, or from public health. We are very happy to say that vaccine rates have increased in all of our age groups in Itasca. Our 12 to 15-year-olds, 40% of them have begun their series, and our 16 to 17-year-olds, 42% have begun their series. Our overall population in Itasca, regardless of your age, the vaccination rate is at 54%. That is 23,606 of our friends and neighbors who received their vaccine series in our county. In vaccine breakthrough, which is another hot topic, these cases remain at 2%. That is 530 of our Itascan friends and neighbors out of the 23,606 who have had a positive COVID test since their vaccination. Of those, 40 were hospitalized, 7 were in the ICU, and 8 have died from COVID. All of those were ages 70 and older. Death from COVID in our vaccinated population is at 0.03%. Please get vaccinated. COVID does not discriminate with who may have long-term health effects or whose life will be taken. At this time last year, we had 18 total deaths from COVID between March and November, the entire pandemic period. This year, we've had 18 deaths in the last 6 weeks alone. Please don't be the person who is taken from your family. Please get vaccinated. If you were hesitant previously, there is no judgment for you changing your mind. Your clinics, your pharmacies, and your public health department are all more than happy to assist you and your loved ones in getting vaccinated. For our situational update, we have identified 227 new COVID cases in the last 7 days and 408 in the last 14. And sadly, we've had 89 deaths, again, 18 in the past 6 weeks alone. And we do offer our condolences to the family and friends of those who have lost their lives from this serious virus. I would now like to introduce our speakers who are staying strong and resilient in caring for Itasca communities during COVID. And there are so many Itascans doing good things, and they're showing kindness to their neighbors, including our healthcare workers and our school staff and leaders. We honor you and we thank you for your grace and goodness. We will now hear from Sue Estey, Executive Director, Second Harvest North Central Food Bank.
Hi, everyone. Thank you, Kelly, for inviting me to talk today. I'm happy to report that Second Harvest is continuing to do the important work of making sure that people are getting the food they need. We started early on, way back in the very beginning of the pandemic, to implement strict COVID protocols in order to keep the neighbors that we serve safe, and also our team here and our volunteers. The people that Second Harvest serves are among the most vulnerable in our communities. A lot of people who are food insecure have higher rates of chronic disease, and certainly are at higher risk of negative impact from COVID. So early on, we implemented procedures immediately. And also, we need to keep our staff safe, because we've got important work to do. If it wasn't for us, some people would go hungry. So it's very important that I have my team of truck drivers and warehouse workers healthy and able to deliver the food out to the communities who need it. So we have continued with most of our COVID protocols since the very beginning, with masking. Now we are masking recommended and welcome, but we're not requiring it. But we are still doing our social distancing, our extra cleaning for our team here. But as far as how we are helping the public, our neighbors that we serve, we have strict protocols about contact with the public. So our people who need food are picking up their food outside, pre-boxed, so there's no contact or very little contact between the people who are providing the food and people picking it up. So the pre-boxed food is available. And we have also changed our documentation records to avoid contact. So there's no longer any, you don't have to sign for things, so way less contact. We have also done less contact procedures or protocols with our senior commodity boxes. Seniors no longer have to come in and sign. They're just picking up their product out at the outside or at the curb or getting it delivered. And then also very important in our hunger relief efforts in the last 18 months are our mobile pop-up pantries, where folks don't even get out of their car. The food bank parks the truck at a location, and people drive through and pick up the food that they need. So that's really been an excellent way to get food out to people who need it and keep them and our staff and our volunteers from passing on any infection. So that's what we've been doing, and we've been extremely busy extremely grateful for the support of the community and our ability to really step up during this crazy time of crisis and provide the food that so many people need in our community. It has been, not only do we provide food, but we provide hope. And if folks are really in crisis and really afraid, at least they have one less thing to worry about if they have food at home to feed their kids. So, you know, that's what we have striven to do, and we have not missed one beat through the entire pandemic. We have been here every day, getting the work done and making sure that our neighbors have the food that they need. So that's our update, and you know, thank you so much.
We will now hear from Andy Morgan, Captain of the Grand Rapids Police Department.
Hi, thanks for having us. Yeah, my name is Andy Morgan. I'm a captain with Grand Rapids PD. Recently, we've done some restructuring in the past handful of months. Scott Johnson stepped out of the police department, was replaced by Chief Steve Shar. Sergeant Ott, along with myself, jumped up into new captain spot, newly developed part of the restructuring. And then from there, Investigator Jeremy Nelson, Officer Matt O'Rourke moved into the vacant sergeant spot. As far as the COVID aspect and how it's affected GRPD, it's no surprise that it's had a heavy influence the past year and a half. GRPD's primary role throughout remained and remains ensuring public safety. Certainly became tricky when efforts and practices were put in place to limit everybody's face-to-face contact. Ultimately, COVID forced the PD to really take a look at what services we offered and how we, roll out or deliver those services. For a while, we transitioned from primarily relying on person-to-person interactions to depending on more phone interactions. For a while, we did plain and simple didn't respond to certain calls that we would have pre-pandemic. I'll say this was fairly common around the state, forced every agency to take a look at, like I said, what services we're providing and how we go about, maintaining the safety of both the public and individual employees. Yeah, we've seen it through all kinds of different aspects within the criminal justice world, other law enforcement agencies, that being local, state, and federal, courts, probation, jail facilities, social services, just like the rest of the world, seen changes in policies, protocols, practices that directly affected, law enforcement services that we delivered or attempted to deliver or continue to deliver. Again, it's all done in the idea of maintaining safety both for the public and the individual employee to ensure that the agency is able to continue to provide the service. Internally, again, we promoted masking, at times requiring it. Other internal efforts included, for a while, we didn't have support staff here answering phones. We had investigators working from home from computers, obviously responding out to priority calls. And we also adjusted patrol response and scheduling, again, depending more on technology and less on personal face-to-face contact. As COVID continued, we continued to reassess and adjust services and practices. We attempt, in attempts to get back closer to, normal. But in all reality, I'm certain that, pandemic has brought some changes to law enforcement and how we respond that are perhaps lasting. We're attempting to get back, further involved with face-to-face interactions with the community. We got a handful of programs coming up, such as Shop with the Hero, Polar Plunge, Citizens Academy, an area youth camp. Obviously, with those upcoming, needing to adjust and look at, do we participate in these? And if so, how are they done to ensure, safety for all? And it's certainly GRPD's intention to continue to strengthen the relationship with the community that we serve. by delivering, respectable police service, while attempting to get back closer to normal.
Thank you. And we will now hear from Logan Kushel, Engagement Team Lead, and Abby Lane, Store Director from Target in Grand Rapids.
Hi, thank you for having us. So safety is the most important thing for our guests and for our team. And safety is how we show care for our team. So this is something that's been very important for us over the last year and a half as we've been on this COVID journey. So for our team, some of the measures that we have taken, and they've really evolved over time, is to continue to focus on protecting the safety of our team members. So some of the things we've done are encouraging our team to stay home if they are sick. We also encourage team member health checks before they come to work, and we provided free thermometers to all of our team members, so they have access to that and are able to do those. We do require face masking for our team at work. We also provide face masks, so both the cloth reusable and disposable. And then we've offered free vaccinations for our team, as well as paid time for if they choose to get a vaccine for the time that they take away from work to get their vaccine, as well as paid time for recovery for adverse effects from the vaccination. In addition to that, we've offered to pay for the team members' Uber transportation for getting to and from being able to get their vaccine as well in areas that have Uber. We offer free boosters for team members right now as well, actually right at our CVS location. We've invested in cleaning also for the store. So we've actually invested in a cleaning job for team members where they clean all high touch point areas in the store. So starting 2 hours before store open, they clean everything from office equipment to devices, registers, computers, break rooms, and store equipment to help keep the team safe. Starting last year, we've been doing, we did a COVID paid vulnerable leave option for our team members. So if they had an underlying health condition, they had the option of taking a paid 30-day leave to protect themselves from the virus. We also offer paid COVID close contact leave or paid medical leave if a team member is positive. So if they test positive or if they have somebody at home that is positive, we pay for that quarantine time for them and allow for the care of themselves and their family member without a negative impact to their attendance. When it comes to things that we do for our team in terms of like our break room, we do a lot of food events for our team. So we really like to recognize them and show our appreciation for them. So we've had to look at how we do those things differently. So we've moved to individually wrapped food, snacks, beverages, or anything that we provide for them, as well as individually wrapped utensils for our team, and social distancing measures. So whether that's on or off days to help prevent that close contact. We also moved to Zoom meetings across our organization. So instead of meeting with other store teams and getting together, we now do a lot more digitally. We have hired seasonally. So last year we hired quite a few seasonal team members to help support the surge in business. And we even took our team overnight to prevent the number of people from being in our building at the same time. So for team member safety and exposure. We actually took our team overnight and gave them the option to work overnight if they felt safer to do so. And then as a company, we invested in a guest counting app that would monitor with our camera systems how many guests were in our building at any given time to make sure that we didn't reach our maximum capacity for guests. In addition, we've offered Frontline team member bonuses for our team members. We've done 6 of those, $200 bonuses over the last year and a half or so for our team members, just for being frontline workers during COVID to show our appreciation.
We have also invested in our Serious MD doctor appointments for team members. So if they don't want to go into the clinic, if they feel safer over the phone, that is free for all team members through our team member life resources that Target offers. And they can get a checkup virtually rather than going into the clinic. We have also lots of other team member life resources available to our team. You know, oh yeah, the 5 free counseling sessions that we have for them just if they need it. So that's an awesome resource for them. We also have backup childcare benefits for them, for parents, and if they need paid daycare reimbursement, if their daycare closes. And that can be up to $100 a day. So that has also been very awesome for our team members to have as well. We do have hand sanitizer, all offstage areas, as well as sanitizing stations with different supplies. So as far as hand wipes, disinfecting wipes, pretty much everywhere at a computer, everywhere that somebody is sitting in our break room, they are all located there. And we stock those regularly every single day to make sure that our team is safe in all aspects of the building. As far as our guests, our goal is to have it be the safest place to shop. So we have really strived to keep that goal running. We do drive up, which is obviously a contactless option, and that has been huge for us. Just for people that, especially during the start of the pandemic a year and a half ago, that were not comfortable coming into the store. And even now when we've had this new surge, we've seen a huge rush in drive up. Many of the same things that went for our team also go for our guests. So we do have obviously masks on our team members to make them feel safe for people coming into the store, as well as the cleaning team member to hopefully feel make those guests feel welcome as well. We've installed touch-free soap dispensers in all of our restrooms, as well as everywhere around the store, back at our electronics expo, different points of the store. We don't require our guests to wear masks, but it is obviously, we want them to, if at all possible, especially if not vaccinated. We do strongly recommend that. Touch-free hand dryers as well, and handles on our doors, so we aren't having that germ spread right there. Cleaning card readers, our self-checkout after guests come, always somebody standing there to make sure that, especially when you're doing things yourself, it's getting cleaned afterwards, as well as at our check lanes. And we've removed our seating areas in certain areas of the store just to take that away. I know that a lot of guests like that, but just for the safety of everybody, you know, in our food areas, Starbucks, and then our signing as well. What else do we have? Oh yes, we did quarantine our returns for our soft line. So anything that was coming through, we had to quarantine it for a certain period of time before it was going back onto the floor. Also social distancing at the check lanes for our vulnerable guest hours we also had. So those were before the store opened. We had certain times and you know, days of the week that we had more vulnerable guests coming in to shop. So if they felt more comfortable, they could. We bought different essentials, so hand sanitizers, cleaning, disinfectant wipes, obviously the masks in the break room, as well as available to anybody that comes into the store. So lots of people definitely take us up on that. If they forgot their masks, we always have them available to guests to come into the store. And yeah, I think those are kind of the biggest things, just once again, striving for that goal of making it the safest place to shop.
Thank you so much to our panelists. A lot of great work happening in our community. So we are moving into the question and answer portion of our briefing, and we ask that our media guests submit their questions in the chat, and we will ask panelists to respond, also with your name and the organization you represent. And as a reminder, we do have John Pedersen, Interim Vice President of Operations from Grand Itasca Clinic and Hospital, on for this portion. We do have our first question already. Kathy Lynn, KOZY. Sue Esty, are there still volunteer opportunities available at the food shelf?
Yes, there are. We are back to bringing in volunteers after a hiatus last year during the height of COVID. We're doing smaller groups and more social distancing, but yes, we are definitely taking volunteers both at the food shelf and doing the repack and repackaging work at the food bank. So contact our volunteer coordinator and get set up if you're interested.
Other questions from our media? Okay, I'm seeing none. I really encourage everyone to get vaccinated if you are eligible, get your booster if you are eligible, and continue to honor and recognize all the good happening in our community and all the people who are staying graceful and kind to each other. We appreciate you. Thanks so much. Stay well.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.